Hi, I'm Dr Cronin, Specialist Plastic Surgeon at the Coastal Clinic, and today I'm talking about breast implant removal. Patients present requesting breast implant removal for a variety of different reasons. For some of these patients, it will be due to complications from having implants placed or implants that may have been placed many years ago, such as rupture or capsular contracture. For some patients, having breast implants in place just no longer aligns with how they identify themselves or view themselves, or they may impede their activities of daily living or exercise, and it's just not how they sort of see themselves anymore, and so they want to have them removed for aesthetic reasons, essentially. There are other patients who have become concerned about the potential for their implants to be making them feel unwell or causing other symptoms that are unexplained by other investigations, and so some patients present to have them removed to see if the removal of those implants can improve those symptoms in their life. Initial consultation, I'll discuss with the patient what implant they have had placed, how long ago it's been placed, what issues they've been having with it, be it contracture of the capsule, rupture of the implant, or changes in the breast aesthetic that they no longer wish to maintain. I'll go through their medical history and examine them to see essentially what their breast will look like after the implant is removed, and then make an assessment as to whether that breast and that patient may need any other adjunctive procedures such as a breast lift or fat graft into the breast in order to maintain the desired aesthetic after the implant's been removed. I often get asked about En-Bloc capsulectomy. Essentially, the capsule is a three-dimensional scar that a body forms around a breast implant, and the body will do this for any foreign body, be it a knee replacement or a pacemaker or a lap band. Anything that sits in the body for long enough will be covered by this scar tissue, essentially to wall it off from the rest of the patient. The only difference with breast implants are that these are the only implantable device that are designed to be sort of soft and feel and move like breast tissue. And so that capsule, if it contracts or if it becomes diseased or calcified, can start to change the shape of the implant as well. An En-Bloc capsulectomy just means that the implant is never breached. So the dissection is all the way down to the capsule and then underneath the capsule and over the top of the capsule, and the implant is removed with the capsule still surrounding it, all in one procedure. And there's a few different indications for doing that, such as rupture or concerns about ALCL or breast implant associated illnesses. For the insertion of an implant, the size of the scar is typically around 4 or 5 centimetres in length. Obviously, placing an implant is much easier than removing the implant, particularly with the capsule around it, because they may become quite firm and hard. And so I use the analogy that the length of the scar that's required will be similar to the size of the implant that's been removed. Similar to a child being delivered through a cesarean, the length of the scar needs to be able to accommodate the width of the baby's head as they're delivered. So most patients could expect that their inframammary fold scar, although it may have been 4 or 5 centimetres for the placement of the implant, to be between 8 and 10 centimetres in order to remove that implant with all of the capsule around it. Procedure is typically performed as a day procedure, so patients would go home the same day. They would wake up in recovery in their post-operative compression garment with one drain on each side. The nursing staff here at the Coastal Clinic would contact the patient the following day to check how much drainage has come from those 2 drains over the course of the last 24 hours. They're typically removed around day 3 or 4. So if the procedure was performed on, say, a Friday, the patient would be home over the weekend and then the drains are removed on Monday. Recovery or downtime from an explant procedure is very similar to the recovery from having an implant placed in the first place. So for patients that have had that many years ago and can't remember what that was like, typically patients would require pain relief for a few days post-operatively, although most patients report that they've stopped their pain relief after 4 or 5 days. the drains would be removed at 3 days. Most patients would feel comfortable driving a car again after about a week, and depending on what they do for work, most patients would be able to go back to work after a week or two. Can typically return to light exercise after 2 or 3 weeks post-operatively. I do caution patients not to do anything that may cause them to perspire, and that's more to do with keeping the surgical site clean and dry, and also maintaining the blood supply to the level of the skin and not drawing it away, as exercise can descend it to the muscles and the heart and the lungs. I tell patients not to expect to go back to heavy exercise and high intensity interval training until about 6 weeks post-operatively. I'll be asked if the breast will change in shape after the implant is removed and in those preceding months after the implant is removed, and the short answer to that is yes. Skin will retract and has a capacity to retract, but it's a little bit dependent on some patient factors and on the implant factors as well. So for patients that are very lean and had a minimal amount of their own native breast tissue, who have had a very large implant placed or have had that implant placed for many years, I'd expect that the skin has stretched out to accommodate that implant, and when the implant is removed, there'll be a relative excess of skin, which under the effects of gravity would lead to descent and ptosis of the breast. And it's for that reason that most of the women that I see for consideration of explant surgery benefit from or require a post-explant mastopexy in the same procedure as well. Because for an implant that may be 350 or 400 cc's, if you were to perform a breast reduction on a patient and remove that amount of breast tissue, it would be expected that you'd also be removing an amount of skin commensurate with that to maintain the shape of the breast. And it's no different if you're removing breast tissue or if you're removing a breast implant. That excess skin needs to be removed and the nipple position put back onto the correct place on the breast as well. There will be some women who were already reasonably large breasted, who have a very modest implant and have not had that implant in there for very long, who don't have any descent of the breast and have a good nipple position, that may not require a mastopexy at the same time or a breast lift at the same time, but obviously those patients are in the minority.